Hello, and welcome to Live Healthy, Live Well, West Virginia. I'm your host, Dr. Lisa Costello, a pediatric hospitalist and assistant professor of pediatrics at the West Virginia University School of Medicine. My guest today is Dr. Kevin Junkins. Dr. Junkins serves as the Chief Medical Officer, Behavioral Health for Community Care West Virginia. He is board certified in general psychiatry and child and adolescent psychiatry. After completing his training, he joined Community Care West Virginia to assist in development of a behavioral health program to complement existing community care services. He is joining us today to discuss behavioral health. Welcome to the show, Dr. Junkins.
Thank you, Lisa. It's a great pleasure to be here today.
Yes, it's so great to talk with you. So Dr. Junkins and I went to medical school together, and I have been so fortunate as a pediatrician to have the opportunity to work with him, and wanted to have him on the show to really talk about an important topic for everyone, and that is behavioral health. And so we brought an expert on who has training particularly in child and adolescent behavioral health as a pediatrician, and as many people interact with kids of various ages, we know more and more, and certainly since the pandemic, how much of a toll life has taken on behavioral health. So thank you so much for joining us today.
Thank you.
So let's kind of jump right in and kind of talk to us about why behavioral health is so important. I think a lot of times we might use behavioral health and mental health interchangeably. So maybe kind of talk about why we really need to be talking about behavioral health when we're talking about living healthy lives.
Absolutely. So you're right. We do use those terms interchangeably, and I'll do that today. So behavioral health and mental health, have similar connotations, but our mental health is often an overlooked or unaddressed part of healthcare. And that happens for various reasons, such as busy schedules, stigma, lack of resources, reluctance to discuss one's mental health, or really a lack of understanding of the importance of good mental health. It's especially important here in West Virginia. Pre-COVID data suggested that about 26%, so over one quarter of West Virginians were depressed. Now, we all know that during COVID, those numbers shot up, so that number only increased during the COVID pandemic. We know that many of these West Virginians will not seek treatment for their mental health conditions, and some studies cite that as many as over half of people with clinical depression do not seek treatment. This is really unfortunate because we know that undiagnosed or untreated or even undertreated mental health conditions can lead to other mental health conditions, but also physical health conditions like heart disease, diabetes, high blood pressure.
Yeah, and I think that's so important, and kind of, you kind of started there, but really, I do think sometimes there's a lot of stigma, and we've had other guests talk about stigma with certain diseases, and certainly when we talk about behavioral health or mental health, a lot of times there's stigma associated with that. However, really, our mental health, kind of our behavioral health impacts our everyday life. Can you kind of share a little bit more about what you were talking about, how, our mental health contributes to really things that we do every single day?
Yes, we don't realize the impact that our mental health has on our everyday lives until we really start to think about it. So it really dictates almost everything in our lives. Every choice that we make is influenced by how we perceive things and our outlook on life. I'm sure that we can all relate when we've had a low mood or a stressful situation. We tend to think and act differently than we do when things are going great. Persons with poor mental health or mental health conditions have increased rates of missed school and work. Their work productivity is worse per capita, and they have problems with interpersonal relationships in the workplace, which can lead to loss of employment, hours being cut, or problems finding new employment, which leads to problems with finances, which can lead to issues with nutrition, housing, utilities, and even transportation, to name a few. So many mental health conditions really affect our interpersonal relationships. That can lead to things like loneliness and social isolation. And people with untreated mental health issues may find themselves turning to self-medicating with alcohol, marijuana, or other substances. This can lead to substance use issues, which also come with their own impacts on our lives. Many times there can be a cascading effect where we have depression or anxiety, and that leads to this certain circumstance and that certain circumstance, and it leads one problem leads into another problem. So when we really start thinking about it, it's all about our perception of life. And someone who is depressed or anxious may perceive life differently and make different decisions than they would if they were doing mentally well.
Yeah, and I think that's so important to you know have people understand or be open to making this a priority for themselves. I think, we do it in all aspects of our life. I sprain my ankle, I'm going to kind of push through it, or apologies to the viewers, thanks for understanding I have a little raspy voice this episode. We always kind of try to push on, and I think a lot of times we do that when it comes to our mental health as well. So how can someone make their behavioral health, their mental health, a priority, and really why should they?
Well, I'll start with the why. So as we talked already, Dr. Costello, our behavioral and mental health drives our everyday choices and lives. It affects our health both in the short term and long term. It affects our relationships and finances. Many of us lead very busy lives, and there's not enough time for everything. But we need to really make our mental health and our behavioral health a priority. We need to shift the thinking and make it okay to prioritize our mental health and to talk about that, especially, in relationships and in the workplace, to normalize things like mental health days. And that kind of starts me into the how. It really starts with making the conscious decision that we want to have good mental health. Um, the first step is to start making healthy choices, just like any other medical problem, whether that's in our diet, how much we exercise, ensuring that we have time for adequate sleep. I advise many of my patients to take an inventory of their daily routines and to really evaluate how we are spending our time and the choices we make. When we start to look at that, often people say, well, I don't have the time to do therapy, or I don't have the time to talk to someone, or I don't have time to add exercise. But when we start taking that inventory, we can really start to see that there's some things in our daily schedules that we can eliminate or change or modify. Um, Often when we are starting to prioritize our mental health, we need to really evaluate our careers and relationships, as both of those can be toxic influences on one's quality of life. I always recommend removing toxic influences when we're dealing with mental health issues, because even just taking that step can make an incredible difference in people's lives. One of the big things that we especially talk to in children and adolescents is the relationship that they have with social media and how social media may be affecting their everyday life. And especially if there's cyberbullying or other issues that come along with the social media, we really want them to take an inventory of that and prioritize what's important to them. And if the social media or whatever it may be is having a negative impact on one's life, we really talk about how to remove that toxic influence. We also suggest that people start employing strategies such as exercise, meditation, and yoga. And those are a few examples of interventions that can be implemented without a professional's assistance. Now, if you have more significant mental health concerns, or you feel that your mental health may be past a point where even these life choices are going to be significant, you may need to consult a professional.
Yeah, those are some really great tips, and I think for our viewers, some practical ways to really kind of make behavioral health and mental health a priority. And in your work in the training, as I mentioned, we went to medical school together, and everyone picks a certain specialty, and you went and got training in psychiatry. So talk to our viewers a little bit about what type of kind of conditions that you see in your work as a psychiatrist, and it might be something that an individual may need to seek care with a psychiatrist to get the treatment needed for their behavioral health.
Sure. Yeah, and there's all kinds of misconceptions about mental health, but especially about psychiatry and therapy in general. So a psychiatrist is a medical doctor who has completed medical school, and 4 years of residency after medical school. So once you finish your 4 years of medical school, then there's a 4-year residency. Some psychiatrists decide to take on a fellowship or further specialize in a field such as child psychiatry, forensic psychiatry, addiction medicine, or consultation and liaison psychiatry, to name a few. A psychologist is a person who has a PhD or PsyD, or even in West Virginia is one of the few states that recognizes a master's level psychologist. Psychologists do a lot of the same work that a psychiatrist does, but they do not prescribe medication, so they're not a medical doctor. So psychiatrists are medical doctors that also are able to provide therapy or other interventions other than medications for whatever mental health condition it may be. And speaking of those mental health conditions, we actually treat a pretty broad variety of conditions. We treat mood disorders, things such as depression, bipolar disorder, anxiety disorders like anxiety, generalized anxiety, panic disorder, obsessive compulsive disorder, people who have specific phobias like fear of heights or fear of driving, for example. We treat trauma related disorders, so things like post traumatic stress disorder. We treat psychotic or thought disorders. So those are things such as schizophrenia or delusional disorders. So disorders where people may have delusions or hallucinations. A bulk of our work is involved in treating people with substance use disorders or addictions. So those are things such as alcoholism or opioid use disorder, nicotine disorder, but even things like gambling disorder, or people who have addictions to pornography or video games. We do work with that a lot, especially the video games in our child and adolescent populations. We treat eating disorders like anorexia or bulimia. And we also can treat sexual disorders, so people who have erectile dysfunction or people who have problems with sexual intercourse or have problems with fetishes or things like that.
So really a broad array of different conditions. And I think it's important because, and we can talk a little bit more about this, the stigma that sometimes comes with behavioral health or mental health. And these are diseases and there are treatments for them. And as someone would get care for their diabetes or their cancer or their heart disease, making sure that you're being cared for by someone who is an expert in many of the different diseases that you mentioned is important. I want to shift now and talk a little bit about like the work that you've done in the community because we've had on our show guests to talk about healthcare, workforce shortages, and what really we as a community need to be doing to enhance the workforce. And so can you talk to us a little bit about the work that you've done with community care to expand behavioral health resources here in West Virginia, and I think really can be a model for even other places in Appalachia?
Absolutely. Thank you for asking. It's been an amazing experience to work here at Community Care of West Virginia. Community Care of West Virginia is a nonprofit organization. We're a federally qualified health center, which means that our mission is to serve traditionally underserved populations, such as uninsured persons or underinsured persons, people who live in rural or homeless situations, or even those who are in urban environments but have low socioeconomic status or can't go to care everywhere else. So we are really about providing affordable, quality access to care. What's really great about my position is that we have programs that enable us to see everyone, irregardless of their ability to pay. When I started about 7 years ago after fellowship at WVU, I found that our organization was frustrated with the lack of community mental health resources in the communities that we serve. And they had decided that they couldn't go any further in their quality programs without building their own behavioral health program to address some of the unmet behavioral health needs that many of our patients were experiencing. For example, we had patients with diabetes who were not able to get their A1Cs down or under control because of comorbid depression or anxiety disorders. So we really wanted to focus on how can we provide that integrated consultative environment where we can work together to try to help people meet their unaddressed health needs. We started with 4 employees in the behavioral health section, and we've grown steadily to about 120. We have 6 psychiatrists. 5 of us are child and adolescent psychiatrists. 2 addiction medicine physicians, 5 nurse practitioners, and about 45 therapists that complement a small army of case managers, peer recovery support specialists, nurses, and support staff. Uh, we've really focused on providing evidence-based treatment with a focus on both addressing physical health and mental health because they're intricately and intimately linked, as we talked about before.
And kind of share that's incredible growth and really providing resources to individuals. I think telehealth, I'm talking to you today
Yeah.
through capabilities that I think we really saw grow, over time and also in the pandemic. But do we have a shortage of psychiatric providers, particularly when it comes to pediatrics? I have the opportunity to care for individuals in the hospital setting, and there's frequently a behavioral and mental health concern or issue going on that we need to make sure that there's follow-up. So can you share a little bit about that and kind of where we're at and if there really is enough of these providers to care for our population?
There is not, unfortunately, and that is one of my biggest struggles as a healthcare administrator on a daily basis, is trying to recruit and find qualified mental health professionals to recruit people to work in West Virginia. The limiting factor of the growth of our program and many others has been the lack of an adequate mental health workforce in West Virginia. When I have meetings with the other behavioral health organizations in West Virginia and we talk about how we address the current mental health crisis and the mental health epidemic in West Virginia, the number one thing that comes up is that we don't have an adequate workforce to address this. And when you look at the statistics, especially psychiatrists and physicians, we see a lot of our colleagues are aging out of the system. And we're not really replacing those at quite the rate that some of them are aging out, especially in our rural communities. One, we have worked with different partners to try to address and add to the workforce because we all feel that's paramount to combating this epidemic. We've realized that we have to address some of these disparities by forming unique partnerships and working in unique areas or forming unique partnerships to kind of conquer some of these issues that we've developed. And there's a couple different programs that I've had the honor to be a part of. One of those that I'm most personally excited about is we were talking to some of our state representatives and some of our friends at Aetna Better Health of West Virginia about the foster care crisis. West Virginia has struggled over the past few years to address the foster care crisis. There's been a number of lawsuits, amongst other factors, that have prompted changes within that system, and in fact, a restructuring of the Department of Health and Human Resources into 3 separate entities. But there's still a lot of work to be done. West Virginia per capita sends more children to out-of-state placements than other states within the United States. And in fact, the Department of Justice took note of that and had filed a lawsuit against the state of West Virginia. And that was part of what prompted some of the change in our foster care system. And there's been a lot of great changes. One of those was the development of the Mountain Health Promise program. And that program allowed a managed care organization to manage the case management and the medical care of those that are involved in the welfare system. The Department of Health and Human Resources are in state's custody. We worked with Aetna Veteran Health, who holds the contract, and one of their concerns was that there was an extreme lack of child psychiatric services within our more rural communities in West Virginia, and that this created these silos of a lack of mental health resources. And so we talked about how we could address some of these disparities. And one of those that we developed was the Critical Access to Pediatric Psychiatry program. That program allows children that are in the foster care system to be enrolled in the Aetna case management program and then to be seen by a child psychiatrist within 24 to 48 hours. It's really instrumental and really vital that we get these services quickly and early with these children to hopefully help preserve their foster placement or to help the children. Maybe I'm sure you've seen it on the inpatient setting. There's no place for these children to go, so they end up in emergency rooms or shelters. So part of the mission of that program is to really try to help find a disposition, try to get these children help, and really try to reevaluate the situation and see if there's anything that we can offer as far as additional guidance or medication changes to really change that trajectory of the child. So we hope that program might provide more early access to prevent residential placements and to preserve foster placements.
Yeah, I think it's
The other,
a really great kind of initiative. And as you said, kind of identified a need and then, using multiple community partners to try to help address that. And so, really, really great work there. Another area that I think is we're seeing more and more, and for our viewers to know, is to really go into schools and have resources available, whether it's a counselor, but really having behavioral and mental health resources in school. Can you touch a little bit on kind of the work there in regards to providing more resources, in
sure,
schools?
absolutely. Um, when I first started at community care, part of my job responsibilities is I did 1 day a week in Braxton County schools, physically in the schools, working with their administrators, working with the teachers, but most importantly, working with students. And we would do psychiatric services in the school. So basically, we had an outpatient clinic embedded within those Braxton County schools. That was a wonderful experience for me. I learned a lot and I got to meet a lot of really great people. One of the things that we consistently found, and community care is the state's largest provider of school-based health services, by the way. We have about 50 public schools and 2 colleges. And what's really great from a mental health standpoint about providing these services within the schools is it creates access to very vulnerable populations. What is really great is that we have these schools that are in these rural communities that already have the resources um, and already has the buy-in from families, and it has a safe place for children to talk with mental health professionals, whether that be about therapy or psychiatric services. But it really eliminates several barriers that we have for many of these families to be able to get to services. So, for example, we're able to phone the parent in or Zoom the parent in, for example, if they can't make it or they have transportation problems, because, obviously the school bus can bring the child to school. So it eliminates that transportation barrier. Also, if telehealth is an option, but they don't have Wi-Fi at home or access to broadband services, the schools do. So we may be able to provide telehealth services through the school. So our schools are really an underutilized resource in this fight that we have against this mental health epidemic. And I would love to see us using more of those resources, especially after hours, for example, to have clinics within these schools because they are places that are safe and adequate and accessible. The other thing that's really great about school-based mental health care for me as a child psychiatrist is that I'm able to coordinate my care with the school system, and I'm able to coordinate my care with the parents, obviously. But really being able to speak with their teachers, being able to speak with the school psychologist or the special education director really helps me get a good feel for that child, and any changes that we make or any work that we're doing with that child, we can assess how how that's translating into the classroom. But it also allows us to advocate for children if they need certain programs or certain, for example, an individualized education plan or certain curriculum modifications. We have those relationships where we can communicate and work effectively to try to help students get the services and all the help that they need to be successful. The drawback to school-based health is that many of our schools don't have adequate space to employ school-based health services. Schools are always very limited on the space that they have, and as a result, sometimes we have to be very flexible on where we implement those services and how we do those services. I will say that I've seen children in all kinds of different settings, whether that be the gym, the school store, or even a custodial closet. But we do what we have to make it work, and you really have to do that. But it would be nice if we as a state decided to prioritize school-based healthcare And we started to really think about, as we build new schools or do school modifications, adding mental health services and primary care services and spaces to do those services that are therapeutic for children in school. Because in the emerging landscape of healthcare, school-based care is one of those things that we are starting to see become more popular because it's more convenient, it's accessible, and it's able to deliver those services within people's communities rather than having them drive to a bigger population center.
Right, yeah, and I think that that's such a great point, and you mentioned it a little bit earlier about just kind of the integrating of care and how we can do that. And kids spend so much time in school, and so taking the services to them. As we kind of wrap up here, I do want to just briefly touch on stigma because I think that that is a big part, and whether that's getting the care at school or going to your doctor or your healthcare provider, how can we help break the stigma in regards to seeking care for behavioral mental health?
Well, I think one of the big things that fuels stigma is a lack of knowledge and a lack of education about mental health. So I think that it starts with us as mental health provider or as healthcare providers in general, really normalizing mental health, making a safe environment for people to talk about that, ensuring that we're screening people for mental and behavioral health disorders. There's a lot of work that is being done. For example, in schools, there are many curriculums that they're employing that are teaching people about mental health and teaching people about how to seek care. I think we're doing a better job as in healthcare of really making sure that we're talking to people about these things and proactively asking to avoid, because stigma can sometimes keep people from speaking up or talking about it. There are several programs that are in place, things like mental health first aid, which teaches laypersons how to recognize concerning symptoms and how to intervene when they have concerns about someone. The state has implemented prevention lead organizations, which do a lot of prevention work, but part of that prevention work is stigma reduction. And it is about teaching people about these conditions because knowledge really is power. And when you give people knowledge and you give them accurate information about mental health, and as you said earlier, when we talk about it as a disease, just like cancer or diabetes or hypertension, and we really normalize that as a health condition, we will start in the medical community reducing some of that stigma as well if we are able to do that and talk about it as just healthcare, just like anything else that you would go to your doctor for.
Yeah, and thank you so much for the work that you're doing. We've been sharing a few resources that are available here in West Virginia, like helpforwestvirginia.com and 988. And I want to just say to our viewers, if you or someone you know is in crisis, you can call or text 988 to reach the Suicide and Crisis Lifeline. Chat with them online on their website that we've been showing throughout the show. And obviously, if there's ever an emergency, that you can call 911. So I want to thank you, Dr. Junkins, for joining us today and for all of your ongoing work to help people lead healthy lives. And thank you to our viewers for tuning in to Live Healthy, Live Well West Virginia on the Library Television Network.